This video is a short summary of regulation of dietary supplements in the United States. We are kind of hitting the high points here as we review this legislation. First of all, what is a dietary supplement? In the United States, dietary supplements are defined as products that are intended to supplement the diet. So that might be vitamins, minerals, botanicals, meaning different phytonutrients that might be produced in supplement form, as well as amino acids. Dietary supplements are regulated as a subcategory of foods. Dietary supplement regulation is very different from drug regulation in the United States. Supplements are not considered drugs, and they aren't really considered foods either. They are kind of their own category, but they are considered a subcategory of food. So their regulation is much closer to how food is regulated compared to how drugs are regulated in the United States. Over-the-counter and prescription drugs require pre-market approval. So meaning before they can be sold to consumers, they have to get FDA approval. So the company making that drug must provide evidence that the drug is both safe and effective for whatever it is claiming to treat before they're able to sell it. Dietary supplements are not required to get pre-market approval from the FDA. The FDA can only step in reactively and investigate after there is a safety concern from people taking a particular dietary supplement. As far as efficacy, there are no regulations for supplements requiring them to be proven effective before they are sold to consumers. We'll go through a bit of the history of regulation of supplements in the United States, starting with the Federal Food, Drug, and Cosmetic Act of 1938. This act gave the FDA authority over food and drugs, among other things that we're not discussing here today. But the purpose of this was to protect consumers. So one impetus for this act being created was the 1937 sulfanilamide elixir disaster. So this occurred when a drug that had been used to treat strep throat infections safely in tablet and powder form was instead dissolved in liquid diethylene glycol. So the people producing this drug thought that they would like to make a liquid version, and they flavored it raspberry flavored, and people liked it, and so they sold it. Unfortunately, the diethylene glycol turned out to be toxic in the doses that it was being consumed from this elixir. Over 100 people died from consuming this elixir, and partially in response to this disaster, this act was passed. Then in 1976, we have the Proxmire Amendment, and what that did was to amend the Food, Drug, and Cosmetic Act to say that the FDA no longer had the power to limit the potency of dietary supplements. So prior to the Proxmire Amendment, dietary supplements were limited to 150% of the RDA. Supplements could not contain more than 150% of the RDA for that nutrient. The supplement industry pressured Congress, and the Proxmire Amendment was passed, removing those restrictions. This is probably one of the most extensive acts that we'll talk about in this video today, which is the Dietary Supplement Health and Education Act of 1994. You may also hear this referred to as DSHEA for short. So DSHEA amended the Food, Drug, and Cosmetic Act to create a new framework for dietary supplement regulation in which the FDA does not have the authority to approve supplements before they are sold. Under this act, supplement manufacturers are not required to provide proof of safety or efficacy before selling their product. The FDA can retroactively investigate safety issues with supplements, but that only occurs after consumers have already been harmed by a particular supplement. So another part of DSHEA is that it protects proprietary blends. We'll talk about labeling requirements in just a minute, but this is companies that have like a trademarked or a particular blend of nutrients or substances that they put into the particular supplements that they market, and they don't want that like recipe, so to speak, to be publicly available as far as what its ingredients are. So this protects the supplement companies from having to disclose that information. So you will just see it listed on the supplement bottle as a proprietary blend, and you don't know as a consumer what is actually contained in those proprietary blends. The next act that we will talk about is the Dietary Supplement and Non-Prescription Drug Consumer Protection Act of 2006. This act created process for reporting adverse events from dietary supplements. So they created an online portal and a way for both health professionals and individuals to report adverse events from dietary supplements. So if you believe you're having a health issue due to a dietary supplement, and you visit a health professional to get help with that, they can actually submit the adverse event report to the portal. Or if you're not seeing a health professional, you as an individual can also submit adverse events. And this act also requires that supplement companies who are made aware of adverse events due to their product must report that to the FDA. So if consumers are reporting the events to the supplement manufacturers, those companies must then report that to the FDA. Next is the current Good Manufacturing Practices Final Rule of 2007. This says that supplement companies should follow, quote, good manufacturing practices, meaning that what is listed on the label should be what is actually in the supplement. Whatever is listed on the label should be what is actually contained in the supplement. The dose should be correct, and there shouldn't be anything else in the supplement that is not listed on the label, whether that was inadvertent contaminants or supplement companies trying to sneak some other type of ingredient in there. This ruling clarified requirements for labeling and manufacturing processes. Right, next, we have the new dietary ingredient provision, which came to be in 2011. This applies only to ingredients that were not previously marketed before October the 15th, 1994. So if a supplement company is marketing a new ingredient in their products, they must notify the FDA that they plan to do that. And they are expected to provide evidence to the FDA that it is reasonably expected to be safe. Again, there is no requirement that it is reasonably expected to be effective, but they do have to provide evidence that it is reasonably expected to be safe. So what will the future of supplement regulation look like in the United States? There have been multiple attempts to further regulate dietary supplements legislatively. So far, those have failed, often because supplement companies spend a lot of money lobbying legislators to vote against any further regulation of dietary supplements. So as supplements become more popular, we'll have to wait and see what happens from a regulatory standpoint and hope that our legislators do what is necessary to protect the public.